How do we diagnose fibroids? So diagnosis of the fibroids is not tough at all, but sometimes it can be missed. So the woman herself may come with something that she is feeling on her tummy, which is palpable as some hard mass, or her friends would have told her that her stomach is protruding, her trousers may not be fitting her, or her dresses are becoming tight around the tummy and she is feeling something hard there. And many a times her friends would have joked that is she pregnant? Why is the tummy protruding? So these are the commonest things that we come across when we see a woman who has a large fibroid. So otherwise, if the woman doesn't have any symptoms, or if she comes with a symptom of heavy bleeding or menstrual disturbances, what we usually do is a ultrasonography or scanning, how it is commonly known as. So this can be done either through abdominal route or it can be done through a vaginal route, and 100% of the times we can pick up the fibroids with this mode of investigation. The usage of CT scan and MRI is not that frequent in diagnosing the fibroids. MRI is done very rarely when we suspect cancerous changes in the fibroid. The other thing which is now we very commonly use is 3D transvaginal ultrasonography or a 3D scanning, which is used to map the fibroid. So what is this mapping of the fibroid, which is done by this 3D technology? So what we do here is, when we see the number of fibroids may range from 1 to 30 or even 40 sometimes in one woman. Or there could be like the location of the fibroids. So if there are multiple fibroids, they may be in various locations inside the uterus, just on the uterus, or it is extending, encroaching into the cavity of the uterus. So all these things can be mapped in the transvaginal ultrasonography using a 3D technology. So the third thing is there any change in the fibroid, like cystic degeneration where the fibroid dissolves into a liquid, or is there any cancerous changes, or is there any bleeding, necrosis inside the fibroid, which can give us an indication that it could be cancerous. So this is also an important factor. The fourth thing is whether this fibroid is causing any pressure changes. So sometimes the fibroid will cause pressure on the urethra, that is the outflow tract of the urinary bladder, which can lead to retention of the urine. Sometimes this fibroid can press on the ureter and cause collection of the urine inside the kidney, and this can cause infection. This we call it as hydronephrosis. So all these can be picked up by doing a transvaginal ultrasonography with the kidney scan that is done by the transabdominal ultrasonography. 3D technology is now utilized more and more to map the fibroids. MRI is not so frequently used unless we are suspecting a cancer. So thank you very much.